I think about how personalized health can often mean a search on a general search engine, and then you narrow down the search results until you get to what you're finding out.
Right.
Or because of your own personal social network, you hear about some new test, or you hear about some new diet, and you decide to try it. And so there's this idea that because of this network effect, people can bring in information to make better decisions from all over the place. Now, the report that I just did about chronic disease found that people living with chronic disease are naturally less likely to be online. So we find that 80% of people who are healthy are online. Only 62% of people living with chronic disease are online. And so those folks are less likely to be able to take advantage of the health information that's available. But if you can get them online, chronic disease is actually associated with a likelihood to engage in that social conversation online, to consume user-generated content. I was really, after spending so many months looking at this data, it was really depressing, actually, to at first
looking at data for months is depressing.
Looking at data for months is depressing, and reading stories of people and the odds that they face in terms of finding a way out of their situation. And in many cases, there's no way out of the situation. But then seeing that they are actually more likely to take advantage of stuff that you write about in the book, that by sharing together, by marshaling their resources together, they are actually getting a lot out of the internet. And so one of the idea of open sharing was one that really struck a chord when you wrote about it in the book and in my own research and observation in the field. There's this sense that if we could get everybody to share their symptoms, if we could get everybody to share what's going on in their lives, we could get to better decisions.
Right.
Tell a little bit about the reporting that you did with Cure Together and Patients Like Me. And I'm actually really curious, in your reporting, were there downsides to sharing? Were there people who were against it?
Well, yeah, so so the sharing is one of these, openness is one of these things that is actually well demonstrated in the kind of annals of public health to work really well. So when I was writing the book and I would go and do these lit searches for groups, and there's, we all know there are whole industries centered around getting groups of people together to share information and to share stories, and we tend to get a lot of meaning and reinforcement and positive impact from groups. That's well known. That's kind of a basic cornerstone of social work and a lot of behavioral health. The opportunity that we have now is that we can create that network effect, those group effects, through information technology, right? So we all know how communities have formed on Facebook and all these other things, and the opportunity that's one of these connections that hasn't happened yet, or one of kind of bridging the gap. So we can take this principle that's well known to work in biomedical research and actually leverage the thing that the internet is already naturally good at. In fact, the internet was created to galvanize groups of communities together and just share data. So that's what it was built for. So now you're finding these startups that on sometimes completely ignorant of the actual science that they happen to be trafficking along, but they're creating these networks, these communities, and they're helping people share their stories, share their information, share their quantified information, which is actually kind of the next step. The first step, I think, is sharing information or sharing stories and just kind of feeling some sense of emotional comfort. But the second step, which is now happening, is the possibility to aggregate data. And then learn from that and create new research models, and that's actually quite profound, and that's happening with something like patientslikeMe.com, which you mentioned. They're doing some really great data aggregation. 23andMe, the genetics company, It's DNA Day, and you can get your genome scanned for $99 today only. I don't work for them to do it or not, but it's $400 off. So they're doing these other things. They're doing some remarkable things with data aggregation. The question is how the thing that I get from traditional science when I talk about these models is well, that's not peer reviewed. It's how good is that data? Is it dangerous that people are going to be acting, making decisions based on these kind of pooled data sources? And I guess my answer is yes to all that. Yes, it's dangerous on some kind of margins. Somebody might be misusing or misunderstanding what's going on. But Donald Berwick, the Obama's nominee for CMS, wrote this great manifesto in Health Affairs last year about patient empowerment, and he had a phrase, and I'm gonna paraphrase here, but it was your rare condition or your rare circumstance does not make for good policy. Now you're gonna quote. You can give me the good word.
Yeah, I'll find it.
Because that to me is a great phrase. I mean, the idea being that yes, we are a multitude, and there will always be outliers. Where is
Exceptional.
it? Oh yeah, exceptional cases make bad rules, he said. Mm-hmm. You do not successfully rebut my plea for extreme patient-centeredness by telling me that on rare occasions we ought to say no. I say your rare occasions make for very bad rules for the usual occasions. And so the argument that actually we have a huge upside, right? And that's what public health is all about, right? I mean, it's let's move the needle, and let's we should take necessary measures to make sure that where people are concerned about privacy, we make sure that we lock down some privacy concerns. Where people are concerned about misusing information or misunderstanding information, we try to deliver that information in clear, compelling ways that are easy to understand. And there are people working on those strategies. But let's not overlook this opportunity, which is profound, and which healthcare has really is pretty much the last industry other than education to get to, which is the internet changes things. It changes everything that it has touched, and healthcare has been. We were just talking about it. Healthcare has been locked up in this kind of regulatory amber that makes it seemingly impossible to expose to the light of progress and technological innovation. And frankly, that's what's happening in the healthcare establishment. But what you're seeing is this undercurrent of technological companies that cure together patients like me. Those are not coming out of the healthcare establishment. Those are coming out of innovators, engineers, Silicon Valley entrepreneurs, and they're using these strategies to bring change to healthcare. And it's coming one way or another.